The U.S. is officially dealing with yet another surge in coronavirus infections. The country is averaging more than 120,000 new cases per day and over 1,300 deaths. Health experts say a majority of the infections are still caused by the Delta variant. However, the highly contagious Omicron variant is expected to become the dominant strain within weeks. The uptick in cases is already causing cancellations and disruptions across the nation. CBS News' Elise Preston reports.
Good evening, Lana. There are 3 surges happening around the country tonight. There's a surge in Omicron cases, a surge in COVID testing, and a surge in holiday travelers. This all has health officials concerned.
Along with packed airports comes fears of packed hospitals as the Omicron variant spreads at an alarming rate. The number of people traveling is approaching pre-pandemic levels, with 109 million Americans expected to leave home for the holidays, a 34% jump from last year. More than 6 million of them will be flying. Long lines are also at COVID testing sites in New York, Miami, and Rockford, Maryland, where the drive-through testing line stretched for several blocks.
This is not a moment to panic because we know how to protect people.
The CDC says Omicron is expected to surpass Delta as the dominant variant in just weeks. It's now in at least 41 states. In New York City, hospitalizations are up 64% in just 2 weeks.
The rapid growth is frightening.
Columbia University Medical Center's Dr. David Ho is advocating for boosters because being fully vaccinated with the Pfizer, Moderna, and Johnson & Johnson vaccines is proving to be less effective against Omicron.
Well, they all take a huge hit in terms of the antibodies they induce against Omicron.
This comes as Pfizer announces it's testing a 3rd vaccine dose in children under 5 because 2 doses failed to give enough immunity to kids ages 2 to 4. And 2 new CDC studies are showing the effectiveness of the so-called test-to-stay strategy in schools. The studies found that kids exposed to COVID can safely continue in-person learning if they are regularly tested at school. Meanwhile, there's concern over how some tests will hold up against Omicron. Dr. Anthony Fauci says some of the antigen tests may not detect the variant. And as Christmas approaches, doctors have this dire warning.
I think we need to be prepared for a surge in the coming few weeks. The wave that's coming will likely be the biggest one.
And one reason for concern here in New York, there's been 21,000 confirmed cases in the state, the highest it's been since the pandemic began, and half of them were reported in New York City. Lana?
Elise, thank you. For more, let's bring in Dr. Bhavna Lall. She is a clinical assistant professor at the University of Houston College of Medicine. Dr. Lall, welcome back to the show. So you heard Elise reporting that worrisome spike in coronavirus cases here in the U.S. Tell us what's driving this latest surge.
So thanks so much for having me. As you all know, the Omicron variant has a doubling time of 2 to 3 days, and it's growing rapidly. It's much more transmissible. We still have only 61% of the country vaccinated, fully vaccinated, and we're still hoping that the rest of the country gets fully vaccinated. And we really need those people to get vaccinated. In addition, we have the holidays coming up. We have more indoor gatherings happening as well. So we really need to encourage people to use the tools that we have, which are vaccinations, indoor masking, improving ventilation, staying home if you're ill, and testing is so important. Testing before gatherings. And also encouraging people to gather outdoors if they're going to gather. But it's so important to get vaccinated and to get your booster if you have not gotten it as of yet.
And with these breakthrough cases, it's a reminder that even if you are vaccinated, that testing is still so important if you're gathering with loved ones. So hospitalizations in the country have increased about 20% in the last 2 weeks. How is that impacting healthcare workers?
So I think healthcare workers overall, everyone is tired. Everyone has been saying the same thing for the last year, which is please take precautions, please get vaccinated. And surge after surge, we're seeing the same problems that people are not getting vaccinated. There's this concern over people not wearing masks indoors as well. And there's a concern that healthcare workers are really tired. There's also staffing shortages as well. I myself have encouraged so many patients of mine to get vaccinated, and there's still people that refuse to get vaccinated. So we really need people to help us as well, which is hoping that people will take the vaccine if they have not so far, and encouraging people to really take precautions, which is wearing good quality masks, such as KN95s, N95s, or double masking indoors, and also avoiding crowds and testing before gatherings if they're going to gather, and really staying in open ventilated areas. And please just get vaccinated and get the booster if you can. We really need to get the world vaccinated, and we can't stress that enough after surge after surge.
Right. Well, Dr. Lall, there are some people who can't get vaccinated, and I'm thinking of my own 3-year-old, because Pfizer's news right now is that its 2-dose regimen of its COVID-19 vaccine for young children did not provide adequate protection for 2, 3, and 4-year-olds. The company is now testing a 3rd dose for children. How soon might we actually see a vaccine come out for that age group?
So per Pfizer's data, they're hoping to get the vaccine for the age group of 6 months to 5-year-olds in 2022, and they're amending their trial to add a 3rd dose for this age group. So until this age group is vaccinated, of course, we need to continue to take precautions for them as well, which is encouraging masking and other people in your household to be vaccinated. So if you have children of that age group, we really need to get the adults of that age of those children vaccinated and protect them as well.
Could we expect the CDC to update its guidance on boosters, where people can become eligible to receive their 3rd dose sooner than 6 months? I know a friend of mine has asked specifically this question. She's less than 6 months out, but she's planning on gathering with family over the holidays. She wants to know, can she get her booster, and should she get her booster now?
So as of now, CDC recommendations continue to say that wait till 6 months to get your booster. If it's been 6 months after your 2nd dose of Moderna or Pfizer, or 2 months after Johnson & Johnson. As of now, the guidelines have not changed, but again, things are changing pretty rapidly right now with the Omicron variant. So await CDC recommendations in the next coming days, as well as the recommendations for whether fully vaccinated includes 3 doses now of Pfizer and Moderna.
Yeah. Well, the CDC is now recommending Pfizer and Moderna vaccines over Johnson & Johnson. What does this mean for the more than 16 million people in the U.S. who have received the J&J shot?
So if you receive the J&J shot, I encourage you to get the vaccine, the booster vaccine, which includes the Pfizer and Moderna shot. If it's been 2 months since your last Johnson & Johnson dose, if you've had the Johnson & Johnson dose, there is a rare risk of side effects that was concerning for CDC. And if you've had the Johnson & Johnson vaccine, it's been 1 to 2 weeks since you've had the J&J vaccine, you're likely out of that window for the rare risk of side effects that they're referring to. But it's really important that if you've had the J&J vaccine and it's been 2 months since your dose of the J&J vaccine, that you do get a booster of the Pfizer and Moderna dose.
All right, I want to follow up on that, because I think the specifics on this matter for people. If folks have had one J&J vaccine, they've had their follow-up 2nd J&J vaccine, which was recommended. They're now 2 months out from that, or getting close to it. Your recommendation is to get a 3rd shot of either Pfizer or Moderna. Is that right?
No, if you've had a J&J vaccine, you should get a booster of the Pfizer Moderna vaccine 2 months after your J&J shot.
Right, but if you've had a booster with J&J, should you get a 3rd shot with either Pfizer or Moderna?
No, the recommendations are that you just get a 2nd shot of Pfizer or Moderna. So the 1st shot would be the Johnson & Johnson, and the 2nd shot would be the Pfizer or Moderna 2 months after the Johnson & Johnson shot.
Okay, Dr. Bhavna Lall, thank you for all you do.
Thank you for having me.